Welcome to Inspired Caring, Transforming for Population Health. This is the story of Holy Family Memorial, Manitowoc, Wisconsin. I'm Mark Herzog, President and CEO of Holy Family Memorial. This is a presentation to the American Hospital Association's Rural Health Leadership Summit this past February in 2014 in Phoenix, Arizona. The Rural Health Leadership Summit is attended by over 700 leaders from across the country, and this particular presentation was attended by over 125 individuals. The presenters at this program were myself, as well as Laura Fielding, Administrative Director of Organizational Development, and Dr. Amy Stockhausen, pediatrician, and one of our associate medical directors, both of whom have played very important roles in our leadership development and culture shaping. Holy Family Memorial, needed to be shared with the group, is based in Manitowoc, Wisconsin, and we represent an organization and a community of 80,000 individuals, 82,000, a local community of 44,000, and we're nestled between Green Bay and Milwaukee. We are, although part of the Franciscan-sponsored ministry's health system, we operate essentially as an independent, single-market, tightly integrated system. And the term integrated describes the relationship between the hospital and the related clinics that are part of our network. Because of our size and our unique approach to governance and physician leadership, we represent a national laboratory for integration, improvement, meaning the lean and process improvement activities we do, as well as innovation. And we've been recognized on several occasions, as we'll talk about in a second, for those efforts. From a physician point of view, we have actually nearly 90 providers, of which 65 or so are physicians, and the remaining are allied health professionals, such as nurse practitioners, physician's assistants, psychologists, and CRNAs. From the hospital perspective, we are a full-service community hospital emphasizing a very strong specialty focus on orthopedics, interventional cardiology, obstetrics, and cancer, delivered through our joint venture with St. Vincent's Hospital in Green Bay. We have nearly 1,500 employees and volunteers with an average tenure of 15 years or more, representing a deep stake in our community, in our organization, and in our success, as well as some of the challenges that come with the change process. We are very community-focused and very grounded in our community. As a faith-based organization, we have a strong emphasis on values and orientation to the mission. And speaking of mission, our mission statement is that Holy Family Memorial is a network, not an individual, of health professionals who, rooted in the healing ministry of Jesus Christ, provide services to help individuals and our communities achieve healthier lives. And we adopted that mission statement in 2008. Holy Family Memorial has presented its story across the country through a wide range of organizational settings. Includes the American College of Healthcare Executives, the American Hospital Association, the American Society for Quality. One in particular I want to mention is the CoDev 2013 International Open Innovation Conference, which is in San Diego, California. It was an opportunity to share the HFM story, much of which you're seeing here, to a group of over 350 individuals from across the world, actually. It was an international audience with 19 different countries represented. And Holy Family Memorial was the only healthcare provider organization represented at the conference, and it was a great honor indeed. Now, let's take a step back and put the change process and the transformation process in context. We're calling it the big picture. At Holy Family Memorial, we've adopted the language of describing the current environment and what's historically driven the way healthcare is paid for as first curve. And then the second curve of the healthcare environment, which is going to be value-based, is the second curve. In the volume-based current world, we're paid for the volume that we experience, the number of services we provide, not so much on the quality or the outcomes, or not necessarily even the cost of those services. The system is being driven towards what we're calling a value-based second curve environment, where we're paid not for volume. In fact, if you can get a great outcome and a successful quality experience, a safe experience with less volume, so much the better. And so these are very much diametrically opposed systems, and the gap represents a very significant challenge. This was described in something called the American Hospital Association's Hospitals and Care Systems of the Future document from just about 2 years ago. And interesting enough, Holy Family Memorial was one of 30 organizations across the country that was interviewed to help shape that particular white paper for the American Hospital Association. We use at Holy Family Memorial what we call our Reform Roadmap. And the Reform Roadmap is designed to transform culture and our care using our focus on improvement and innovation to allow us to meet that gap that was described between the first and the second curves. The improvement process is focused on our improvement process, our change management tools such as Lean, and removing waste from our system and increasing the value to our customers. The innovation process takes a lot of the techniques and the philosophies from our Lean experience and adopts those into and shapes them into something called the SPUR process, which is the strategic program and unit and review process, which essentially takes every single program and service and large department of our network, and every 3 to 4 years essentially takes it offline and asks why we do that service. Are we good at doing that service? Are we the best in the market to provide that service? Are there better ways of restructuring it to make sure that we're current and fully effective, and so on and so forth? And it has a deep reflection on our mission. And then finally, the transformation is something that we try and keep in front of us at all times because of our awareness that the challenges that are coming down the pike for healthcare and the cost challenges and quality challenges for our entire country will mean that systems and processes have to be different in order to deliver the kind of value and get the kind of outcomes that our community will need and our employers will need to be sustainable in the long term. And this is focused on our culture of adaptability, because if we are adaptable, we will be able to survive and be relevant no matter what the market changes demand. If we're not, it could be very challenging for us to be sustainable. And these different processes are designed to engage everyone associated with our organization, whether it's staff and physicians, leadership, or in the case of transformation, taking it beyond our organizational boundaries and our community boundaries and involving more of a partnership type of approach. This is what we call moving culture and care to the right. Now, key points on the Reform Roadmap are as follows. They're intended to hardwire the way we do things into our culture. It's intended to sharpen our focus from a leadership perspective on strategy and achievement, making sure that we take a step back and really focus on making sure that what we're doing is significant and important. Deeper engagement at all levels of the organization, as was mentioned on the previous slide about the Reform Roadmap, and integrating leadership from physicians into what we do. Most importantly for all of us associated with Holy Family Memorial is that this means raising the bar for success as a leader, as a provider, and as an employee. We've used the phrase to say that we are what we tolerate and we become what we reward. I'd like to spend a moment or two talking about that last phrasing because it's very, very significant. When we see an employee or a colleague or a friend who's not really at their best and not providing the kind of care or service that we think everyone here deserves and our patients certainly deserve, if we don't intervene on that, if we don't step up and say, hey, or you're aware that you're not at your best today and we need to look at things differently, that means we are tolerating something that's less than great for our organization. And that has a direct impact in terms of how patients perceive us. And we see that when we look at some of the challenges we have with HCAHPS scores. In turn, if we don't recognize exceptional employees doing exceptional work and exceptional providers, and we don't make sure that they're rewarded, and in turn, that also is a challenge for us. So, as an organization, myself included, we need to all be sharper in making sure we don't tolerate what we shouldn't, and we reward what we should. And finally, we're using the tactic team approach to take leadership down to levels of the organization much closer to where the work is actually done through these tactic teams. Now, how is HFM applying open innovation between the curves? Well, in the first curve, infrastructure needs to be set for the second curve. We're doing pretty darn well at that. Our information systems are some of the most advanced in the country in terms of its structure, and we're going to be upgrading our systems in the next year or two to reflect even more modern reporting and formatting systems. Our culture work has been recognized nationally, and this presentation is in part a reflection of that. We collaborate in an extremely high level with other area providers in the long-term care areas, as exampled by our long-term care facility partners having some of our primary care physicians' offices actually embedded in their facilities to help provide access to our patients in their settings, but also to the residents of those communities. Unfortunately, in a sense, the payment model is lagging in such that we are delivering exceptional value in the second curve, while payment systems are still largely in the first curve. So that's one of the opportunities to either slow down our progress towards the second curve delivery system, which is not necessarily the best from a quality and service point of view, but it might be necessary from a payment model point of view. Our main focus is trying to get rewarded from the payment point of view for the work that we are doing and we've demonstrated great value at. So, I'd like to take a step back. That's background. What does that mean for how we've designed Holy Family Memorial? And the cartoon here is designed to reflect the fact that many, many small rural organizations like ourselves are feeling a little bit like sheep in a herd, just moving along kind of mindlessly, not knowing what to do. And so this one is an exhortation to say, hey, wait, listen to me. We don't have to be just sheep. And one of the themes with Holy Family Memorial is that we are choosing to try and take our leadership forward and choose our own destiny. And that's what this presentation is about. Our core belief is doing what's right. And that starts from our sponsorships and the spiritual background that they've adopted. And we embody this by saying we start by doing what is necessary, then do what is possible, and suddenly you are doing what's impossible. And that's from St. Francis of Assisi. Another phrase that is very salient to today is, are you meeting the needs of a community or the needs of a corporation? Those words were a quote from Sister Laura Wolf, the president of Franciscan Sponsored Ministries and the sponsoring organization over our Holy Family Memorial. And these are very important because they're a point of reflection of why we do what we do, and in turn, how we do it. In the large corporate sense of medicine, the way a lot of the organizations in the country are going, the sense of community and the focus on it can be lost, and frankly often is lost and subsidiary to the needs of a corporation. And that's something that has impact on how we deliver population health and quality in a community setting. Holy Family Memorial has, for at least the last decade, focused on what we're now calling the right care model, and I want to share that with you. Right care means that we take a great deal of effort to study what is the most effective way of delivering care based on the most appropriate evidence possible. That is much more challenging than it might sound when you just say it that way, given how fast the standards seem to change and how much research is out there. But we do an incredible job of staying on top of what's right for this community. Secondly, we've been very conscious about providing care in the right setting. Not just the setting that we're ready for or where we've invested our assets, but where patients can get the care that they need that is most cost effective to them, the safest, highest quality overall, and in turn, all that equates to the greatest value to our society and our employers and our individual patients. Note, that's not necessarily what's the best for our organization or the most convenient, but it's doing what's right for the community. And then finally, getting the right outcomes, doing the first two in such a way that the long-term benefits are most significant and we minimize their physical and financial risk. And I mentioned the financial risk to our community and our individual patients because with deductibles the way they are, essentially everyone's on the hook for a lot of their own healthcare dollars, and that's going to get more significant every year. And consequently, they're at financial risk for maintaining their homes and the balance of their financial lives overall based on some of the healthcare costs. So we're very sensitive because we live with these people. They are our neighbors, they're our friends, people we see at church and at schools. So we have a lot more ownership. This is not a very, some abstract corporate concept for us. Now, putting this in a big picture perspective, there's a new phrase that's out there as part of the Affordable Care Act called population health. And I want to talk a little bit about that because it helps connect HFM's activities and strategies with our mission statement. And I just want to remind that the mission statement essentially says that we are going to help individuals and communities achieve healthier lives. And this, the challenge behind it gets a little bit more clear when we go through this information from the University of Wisconsin. Population health has a number of factors and that I'm going to talk about, and it basically reduces to 4. And those are health behaviors, the types of things each of us does individually to affect our health. Clinical care, those are the activities of doctors and hospitals and long-term care facilities in the community. There are social and economic factors, and those are the quality of jobs, the type of employment, the academic environment, the government and how they function, economic development, etc. That actually is the most significant contributor to the health of an individual population and the individuals in it. And then finally, clean air and water and the like, and physical safety are also an important part of the equation, but nowhere near as significant as a lot of us might think that they are. So when you think about the challenge between our mission statement to help individuals and communities achieve healthier lives, means we have to focus beyond just the clinical care part, which is 20%. How is that going to be challenging for us? This was an amazing picture to me that I saw back a year and a half ago, which was really stated the case of the problem in a pretty clear way. On the right, there's a billboard for our Heart and Vascular Center when we opened our 24/7 cardiac cath lab. And the It Wasn't Indigestion actually is credited with saving at least one or two people's lives relative to heart attacks. So they said, oh, I better get over to HFM. And it turns out they really did need to be here. And the other side is an actual website from McDonald's called friedrate.com, where you could go and look up extra thick fries and how you can match them with different flavored milkshakes. Obviously, what this summarizes is the efforts of a healthcare organization like ours are facing some pretty tough uphill battles from the social and economic business community represented by McDonald's and the individual behaviors part of the population health matrix represented by the choice to eat at McDonald's. And finally, this isn't just a once-in-a-lifetime thing. In June of 2013, we saw much the same sort of pairing with the colors and the placement left or right being the only big differences. Why is this important? When you look at the regional county comparison, Holy Family Memorial ranked in clinical care a really, really strong 15th out of 72 counties for the healthcare process. Now, this is largely driven by Holy Family Memorial, although Aurora is part of the county delivery system as well. Unfortunately, there is a disconnect in the health outcomes, which is the overall the most important part of this study, which says that Manitowoc County is only 40th out of the 72 counties. So a big difference. What's most striking, however, though, is that there's been great improvement in the clinical care system, something like 40% improvement over the last 4 or 5 years to bring us to the 15th position in the state. Yet that impact on health outcomes has only moved us from 41st to the 40th best in the state. So clearly there's more to population health and great health care, and socioeconomic development is job one. I thought this was, when I first saw this particular map, I thought it was humorous, but the more you think about it, it's pretty challenging. This is a study shown of data that is abstracted from zip codes, and any zip code for any zip code there were more bars listed in the yellow pages than grocery stores, it was colored red. And it doesn't take much of a rocket scientist to notice that Wisconsin, with the exception of a couple of forested areas of the Northwest, is all red. And that represents one of the most significant challenges for our state in particular to get our hands around some of the population health issues. Illinois also has a significant challenge in that regard. How does this all fit together? The health determinants, as I mentioned before, are clinical care. The drivers that they use to measure in clinical care are preventive services, overall acute care, and chronic disease, and some of the measures that come with those. What does that mean to Holy Family Memorial? How is it aligned with our mission and our capabilities and control? Pretty darn strong. Clearly, those services are core to how we've envisioned ourselves in living the mission. We have a lot of expertise in that regard, and we also have a high degree of control over how that's delivered. And that's awesome because we've used that control really, really well to bring us to the 15th best in the state. Health behaviors, what drives those? Tobacco use being minimized or eliminated, higher degrees of physical activity, better diet, nutrition, and moderation in alcohol use. Now, the challenge there, though, while it's mission-driven, it's part of what we think we need to do, that's a shared responsibility and shared control. And that's actually pretty generous because we share an experience with a patient in a very brief setting, once a couple times a year, where they live the rest of their life under their own auspices. So consequently, this is a pretty significant challenge, and one that we know we need to work on, but it's hard because of our lack of direct control. And then finally, the socioeconomic factors, environmental, are things like education and income and air and quality, etc. We support those from a mission point of view, at least philosophically, but we have very limited expertise in these and extremely limited control. So we need to keep that in perspective as we try and deal with looking at the future and saying, how is HFM going to live the mission of helping individuals and communities achieve healthier lives, given the breadth of activities that will need to involve to make that happen? Taking a step back again, over the last decade, what does our transformation look like from the point of view of hospitals, our physician staffing, nurse practitioners and physician assistants, from a leadership point of view, as well as our mission? And I think this is a really important slide to share with the audience because of the fact that the story is fairly profound. A decade ago, a little over a decade ago, it would not be an unusual day to have 90 patients in the hospital. And that was a fairly sustained level of activity back, again, in 2001. Today, that number is closer to 35, sometimes below 30, and so we've transformed in a very significant way. Some of that's by refining the scope of the services we offer, but the vast majority of it is about changing the way we deliver our care. I was talking with our chief medical officer yesterday, and we talked about the number of surgeries that used to have a 1, 2, 3, 4, 5 day stay that are now done as outpatient, and it's tremendous. Cardiac catheterizations a decade ago were almost all inpatient, 2 to 3 day stay kinds of activities. Even the diagnostic care oftentimes was overnight. Now they're almost 80 or 90% outpatient, certainly observation status. So it's dramatic. We even do a much better job with congestive heart failure patients, for instance, through our use of evidence-based medicine and such and so on. So we've changed how healthcare has been delivered in this community by moving care to the right, as referenced before. In terms of the delivery system, obviously, there's been a parallel change as well. We had a smaller group of employed physicians back in 2001, and now we have nearly 90 employed providers. So we've almost seen a complete flip-flop in the way we're delivering care between the hospital and physicians over that decade. From a leadership point of view, we've distributed leadership farther down into the organization. There were 10 vice presidents and above back in 2001. Currently, we have 4, and we'll go to 5 with a chief operating officer announcement we've just made, but still keeping this a very lean team focused on delivering our assets and our resources where care is delivered as much as we possibly can. We've already talked about the mission, but back in 2001, our focus was on providing care and services to all who seek our care. And as we've already discussed, now we've broadened that to focusing on the health of a community and those that live in it. The metrics that are behind this transformation are also very significant. Using our improvement principles and tools, the Right Care model has reduced admissions by over 40%. That's care that for patients who are being delivered through Right Care in settings other than by being in a hospital bed. We've been amongst the most safe hospitals in the country, in the top 2% almost every year. And our quality is exceptional given the complexity of the care we deliver and the types of outreach that we have. Safety, as I mentioned, is extremely strong. And our philosophy is, ironically, that the safest patient for hospitals to care for is the one you never admit. Hospitals are challenging places from a complexity point of view, a resource point of view, very expensive. And if we can deliver that care using the Right Care philosophy outside the hospital setting, everybody benefits. We've done it through a significant growth in the clinic visits, and we've done it in a way through the transformation process, our reform roadmap, that HFM is in a strong financial position to continue riding the curve, closing the gap rather between the two curves. 200 days cash on hand means that if we never collected another dollar of insurance payment or reimbursement, we could run the organization like it is today for over 200 days without having to change our services. That's a very strong nest egg, if you will, to allow us to ride the ups and downs like we're currently in kind of a down cycle as we go forward towards the second curve of reimbursement. Standard & Poor's, who provides a credit review of the organization, agrees very strongly with this. Just about a month and a half ago in March, we were given a stable outlook with a BBB plus credit rating from Standard & Poor's, which for organizations our size is an extremely positive outcome. By comparison, one of our closest competitor has about 110 days cash on hand. What does this look like from the region in terms of the impact on hospital utilization? Every so often we hear comments from employers and insurers and government officials about the expense of care in Manitowoc versus other areas immediately around us, and we took a hard look at that. And this is kind of an astounding figure that I'm going to share. A set of figures I'm going to share with you. This slide talks about population-adjusted regional growth and hospital charges. And we adjust for population because if your population is going up or down, naturally your use of healthcare services should go up or down. With a larger population using more health services, and obviously the reverse for down population and down healthcare costs. What we noticed over that last decade is that in Fox Valley, where there was no new hospital, it's pretty much just the status quo over that same decade from a provider point of view. It went up about 140, 145% in terms of hospital charges. This is inpatient, outpatient combined. So, and that's for residents who live in that community. And these translate to the bills that Medicare and Medicaid are paying, as well as the insurance companies. Brown County, where a brand new Aurora Hospital was built in 2001, saw a rather dramatic increase in hospital charges of just under 200% in that particular community for that same time frame. Again, these are for residents who live in those communities, not that seek care elsewhere. So that's a burden of expense that is being placed right on the employers. In Manitowoc, in 2000, an Aurora facility opened, so it's not, the significant run-up in charges isn't reflected in this particular slide, but over the same time frame, we only saw about 107, 108% increase in hospital charges. So a dramatically lower increase in utilization over that time frame. So this right care philosophy, almost exclusively driven by Holy Family Memorial, has made a dramatic difference in the amount of hospital charges experienced by the residents of this community compared to Green Bay and compared to Fox Valley. So when you talk about who's doing the most to lower costs and present value, it's all about utilization and moving care to the right. Taking care at $20,000 per admission out of the hospital, delivering it as an outpatient at $2,000, or as a clinic visit at $200. And Holy Family Memorial does this better than anyone in the region, hands down. This slide shares with us some evidence about our value proposition. This is from a regional managed care organization who, in the first part of this year, sent us a check for nearly $200,000 to reward us for our incredibly low cost and high quality provided to members of that particular managed care organization in 2013. So this is clear evidence that the right care philosophy and our quality focus and our safety focus is right on and being recognized by at least this particular managed care company. Why should this matter? What if every hospital focused on right care? Back in the 2 slides ago when I talked about the costs of the hospital charges going up in Manitowoc County about 107, 108%, recall that that's both Aurora and Holy Family Memorial combined. If it was just Holy Family Memorial providing all that care in the community, the total dollars, the whole total hospital charges over that same time frame would have been nearly $30 million less. So that already really strong performance for our community would have been truly exceptional. So, as a nation, if we could do our resource reallocation the same way, just think of what we could do in the non-20% clinical care, what we could do with socioeconomic development and the strength of our communities. It would be truly impressive. So, how did Holy Family Memorial do this? We did it by focusing on designing our organization so that we could deliver on this promise. We did it through adopting a culture of learning, becoming steadily more and more open to new ideas and learning how to do things better. Not assuming it's best because of what's done here in Manitowoc, but we can pick up ideas from other parts of the country, other industries, actually other parts of the world. We call it open innovation. And recall on our second or third slide when I talked about this CoDev Open Innovation International Forum, that's why they asked us to come talk there, because we do that better than anybody in the region, and in fact better than many healthcare organizations in the entire country. We have meaningful physician engagement. We are deeply committed to trying to do what's right from a medical point of view, as well as the community, as well as the operational point of view. And we've shifted our focus over the time from saying, hey, we're all about just filling a bed to taking care to the right, moving it to the clinics, moving it to the long-term care facilities, moving it out to other partners. How did we do it? By focusing on our culture. Because culture is all about the caregivers, the people, the staff that deliver the services in the way that we are so proud of. The improvement in lean healthcare we've talked about. We've talked about engagement of the staff and physicians. Open innovation, I've mentioned that as well. And the culture of individual accountability and skillful leadership is really, really strong for the organization, and will need to get stronger still to keep Holy Family Memorial in the position it's in now and grow. And then finally, I've already mentioned taking the SPUR process, keep challenging ourselves to make sure that we're always on a continuous basis relevant and the best possible fit. Holy Family Memorial has relied on 3 strategies to accomplish this transformation over the last few years. First, redesigning care, being a role model for redesigning the care delivery system to achieve excellent quality, cost, and population health outcomes. Our success in doing this has been recognized, as mentioned on that, I think, the third slide, about the various presentations we made to quite a few different kinds of organizations that are interested in learning from us. Exceptional experience for patients, creating experiences so exceptional that patients will choose overwhelmingly Holy Family Memorial. This is the focus of our attention right now. It's right in the crosshairs of our experience, because this is a challenge for us in the sense that we're used to doing things the way we're used to doing things, and both from an employee point of view, provider point of view, systems and processes, and cultural point of view. And we've actually had to make some real tough decisions about providers and systems and services to try and redefine things so that they truly are exceptional customer service experiences. And that is a lot harder because of the way we've been doing things for many, many years. But because we've created this culture of adaptability and engagement, we know we'll be successful moving forward. It will be challenging, however. And the culture. I think we've talked about that quite a bit already. So we're seeking to redesign our care system around exceptional experiences through this ideal culture.